Hi, Torie.
Hi, Gabrielle. How are you?
Fine, thanks. Finally, I meet you.
Indeed.
Not in person, but
Yeah, I'm not sure many people are doing that now. To everybody listening, thank you for being here. Just to introduce you to Gabrielle. And how do I pronounce your surname?
surname, Lignani.
Okay. I haven't got that lovely accent. But if you,
Lignani is fine.
sorry?
In the UK, Lignani, they say, so it's fine.
Okay, cool. Um, so yeah, thank you so much for joining us because you're doing such exciting work and research at UCL, right, Queen's Square, um, to benefit those affected by epilepsy long term. If you could give us a brief overview of what you do, that would be great.
Okay, yes. As you say, I'm working at the UCL at Queen Square and in the Department of Clinical Experimental Epilepsy. And the focus of my research group is mainly to find gene therapy approaches to treat both genetic and not genetic, so acquired epilepsies. So it's obviously at the preclinical level. So we are trying to find the new tools to be translated, hopefully easily and faster to the patients.
How does that work?
So it's a big joint effort of different people in the department, plus also international collaborations. And yes, gene therapy basically is a genetic technology that allows to change the genome of your cells. So basically, it can be used to, for example, correct a mutation in a gene that causes a disease, or can be also used to change the function of the genes that leads to a change in your brain and trying to rescue your pathology.
So making it do something good or normal rather than something dodgy which causes seizures, basically.
Yes, or modified in some way your genome to find a way to modify the function of your neurons that are
Yeah. Oh my goodness.
trying to
And,
seizures.
and so can you tell me how you got started in the field of epileptology and research?
Yeah, it's been like I think 12 years that I'm working in this field. I started in Italy for 6 years, where I did my PhD and the beginning of my research. But I was more involved in understanding the mechanisms at the basis of the epilepsy.
Okay.
Then I moved 6 years ago at UCL, where there was already a program for gene therapy led by Dimitri Kulma, Matthew Walker, and Stephanie Schorsch. And I joined the group, and we started to do I started to investigate a new tool to treat epilepsy. So I wanted to use my knowledge of the pathophysiological part to understand the mechanism of epilepsy and trying to apply it to find the new treatments, basically.
Okay. This is still, I have to confess, lots of this is still going over my head, but it sounds exciting. No matter what, I'm thinking I might have to visit your lab or something because this is so cool.
Yeah.
Can you just give us what is the basic to a lay person, what is gene therapy?
Okay, gene therapy is a tool, a treatment that can change your cell in a way that they can work normally if they were altered. If you have a pathology, obviously there were some problem with the cells and they were not work properly. One application is if you have a genetic disease, is with the gene therapy you can correct that mutations. So you can
just go in, you find the gene and you go switch it on and off and then get it to spread almost like a cancer, or what is it like that?
Yeah, you need to use tools to enter in the cell and modify the genome of the cells. What we are doing mostly is some form of genetic epilepsies like Dravet syndrome, but mostly we're
for those who don't know, sorry to interrupt, Dravet syndrome is a rare type of epilepsy, just for those who aren't aware.
Yeah. Very severe childhood epilepsy. And but the main focus now is to find treatment for focal epilepsy that are due to different causes, can be due to trauma, strokes, also genetics, but they have the epilepsy start always in a part of the brain well defined. So we know what we need to treat, and so we can directly deliver and target and deliver the tool in that area and stop the seizure starting, basically.
So, okay, if I give you an example, so I have left temporal sclerosis, so focal epilepsy, and although there's not too much dodgy stuff left, but there's a bit there. So imagine if I was one of the specimens or one of your patients, how would you go, you would identify that sclerosis and you'd be like, right, here you go, mate, and then hopefully get it to spread through that damaged tissue, or? Yeah,
we're using viruses.
That's so cool. Okay, yeah.
At this moment, maybe it's not the
yeah, maybe not a good word, but yeah.
But very not harmful virus that are that can basically enter in your cells and deliver your genetic tools. So basically, in focal epilepsy, you can inject your cocktail of substances in this brain area, and all the cells in that area will receive the genetic tool to rescue them.
Wow. Well, I trust you, and I trust UCL, and I trust Mark Richardson. So if you want to like jab some in my damaged tissue, that's fine. You can.
There is actually a clinical trial that we start soon that was for patients with focal epilepsy.
Oh my God, I shouldn't have said anything. Okay, this is cool. Right, we've been going on and on and on. So we can no doubt continue this conversation at a later date. But for people that are interested in learning more about you, what you do, your lab, etc., how should they contact you or look you up?
They can contact me on the UCLA email. I have also a website of my research group that is lignanilab.com, where there are all the contacts there, and obviously on Twitter at my Twitter account or the lab.
What's that called? What's your Twitter account called?
Is Lignani Lab.
Okay. Well, for anyone listening, I will put these details on YouTube afterwards. I'm going to upload this video and I'll put the details underneath.